Diagnosis by visceral organs. We discuss stomach and gallbladder illnesses. The principal abnormalities in stomach illnesses are impairment of acceptance of food and drink and abnormal ascent of stomach chi. Deficiency of stomach yin usually results from one of two circumstances. In one, chronic heat in the stomach causes stagnation of liver chi, which can then give rise to endogenous fire. In the other, unbalanced indulgence in warm and dry foods damages stomach yin. With the loss of nourishment from stomach yin, stomach chi becomes disordered or ascends abnormally. The typical syndrome of deficiency of stomach yin includes dull gastric pain with regurgitation, indigestion with bloating or dry heaves, hiccup, anorexia despite hunger, dry mouth and throat, dry constipation, a red tongue with little coating, and a thread-like and rapid pulse. Food retention mainly results from overeating, binge eating, or drinking, or dietary indiscretion in the presence of chronic deficiency of stomach chi. In either case, there is indigestion leading to food retention in the stomach, hence blockage of stomach chi and loss of its downward transportation function. There are two main syndromes. One includes epigastric tightness and distension, sometimes epigastric pain, foul eructation, acid regurgitation, vomiting of malodorous acid and rotten foods with relief of pain and distension. The other includes borborygmus with diarrhea of foul and rotten feces. In both patterns, the tongue coating is thick and greasy, and the pulse is slippery. Cold in stomach occurs in two circumstances. In one, when the cold evil attacks the stomach or with excessive indulgence in cold food and drinks. Cold gels in the stomach and causes blockage. In the other, in a patient with chronic fatigue or illness, stomach yang may become chronically deficient. If the stomach is now attacked by exogenous cold, stomach yang is further injured and the stomach loses its warmth. As yin cold accumulates, it gels and qi stagnates so that food is retained and qi becomes deficient. When cold gels in the stomach, there is cold epigastric pain. In mild cases, the pain persists. In severe cases, it becomes spasmodic, and cold aggravates while warmth alleviates it. Another pattern includes weariness and weakness, cold aversion with cold limbs, epigastric pain with preference for pressure. The pain is alleviated by food, yet another pattern includes gurgling in the stomach and regurgitation of clear fluids. In all these patterns, the tongue is pale with white, smooth coating. The pulse is slow or taut. Thank you for listening.